Hello everyone, my name is Shushmita Acharya and today I will be presenting on anxiety disorder, a common but often misunderstood mental health issue. In this presentation, I will talk about what anxiety disorder are, how they relate to the Australian context, the risk factor, common treatment, the connection with trauma and my personal learning from SNUG 206. Anxiety is a normal response to stress, but when it becomes excessive, persistent, and interferes with daily life, it's called as an anxiety disorder. Anxiety disorder is an umbrella term for condition where excessive fear or worry interferes with the daily life. There are different types of anxiety disorder, such as generalized anxiety disorder, a mental health condition characterized by persistent and excessive worry about everyday things that is difficult to control and lasts for at least 6 months. Panic disorder, that is characterized by reoccurring unexpected panic attacks. Social anxiety disorder, a condition characterized by an intense fear of social situation due to the worry of being judged, humiliated, or criticized. And lastly, specific phobias, which is characterized by an extreme, unreasonable, and irrational fear associated with a specific object, situation, or concept which poses little or no actual danger. Common symptoms of anxiety disorder. People with anxiety disorder often experience intense fear, racing thoughts, restlessness, and physical symptoms like a rapid heartbeat or sweating. It's one of the most common mental health conditions in Australia, affecting people of all ages and backgrounds. Anxiety disorder in the Australian context. In Australia, anxiety disorder are the most prevalent mental health condition. According to the Australian Bureau of Statistics, around 17% of Australians aged 16 to 85, that's about 3.3 million people, experience an anxiety disorder every year. Women are more likely to experience anxiety than men, and rates are especially high among young adults aged 18 to 24. The COVID 19 pandemic, financial stress, and climate anxiety have all contributed to rising cases in recent years. Causes and risk factors. Anxiety disorders develop from a mix of biological, psychological, and social factors. Biological factors include genetics and chemical imbalances in the brain. Psychological factors include low esteem, self esteem, perfectionism, or negative thinking patterns. Social risk factors include childhood trauma, family conflict, bullying, work stress, or social isolation. Chronic physical illness and substance use can also increase the risk. It's important to recognize this early warning sign so we can intervene before anxiety becomes disabling. Impact on daily life. People with anxiety disorders often struggle with persistent worry, sleep disturbance, fatigue, and difficulty concentrating. Physically, they may feel tense, have stomach issue, or experience panic attack. These systems can interfere with work, study, and relationship, reducing overall quality of life. In severe cases, untreated anxiety can lead to depression or substance misuse. Treatment for anxiety disorders. Treatment depends on the individual but often includes a combination of therapy, medication, and self care strategies. The main approaches are psychological therapies such as cognitive behavioral therapy, medication, and lifestyle interventions. It's most effective when care is holistic, combining professional support with social and emotional well being. Psychological therapies. Cognitive behavioral therapy is considered the gold standard for anxiety. It helps people identify and change unhelpful thoughts and behaviors. Other therapies like mindfulness based therapy, exposure therapy, and acceptance and commitment therapy are also effective. The benefits are that these treatments address the root cause and build long term coping skill. However, they require motivation and access to trained professionals, which can be limited in rural areas. Medication treatment. Medications such as SSRIs and SNRIs are commonly prescribed to manage symptoms. They can reduce anxiety and improve mood, especially when combined with therapy. However, medication can have side effects like drowsiness, nausea, or dependency risk. Lifestyle and self management. Lifestyle changes also play a major role. Regular exercise, balanced diet, adequate sleep, and mindfulness practice can significantly reduce anxiety symptoms. Social support from friends, families, or peer group is also essential. Trauma and anxiety disorder. The relationship between trauma and anxiety disorder is profound, complex, and critically important to understand. This connection has been one of the most impactful learnings from SNOC 206 for me. Trauma exposure is one of the strongest predictors of anxiety disorder. Research consistently demonstrates that adverse childhood experiences, including abuse, neglect, witnessing violence, or household dysfunction, dramatically increase anxiety disorder risks across the lifespan. The relationship is dose dependent. More type of trauma predict higher anxiety, severity, and more complex presentation. Neurobiological mechanisms explain this connection. Trauma fundamentally alters the developing brain and stress response system. This results in chronic hyperarousal, heightened startle response, and difficulty returning to baseline after stress, core feature of many anxiety disorder. Psychologically, trauma creates lasting cognitive and emotional changes. Trauma survivors develop hypervigilance, constant scanning for threat as a survival strategy. When adaptive during trauma, it becomes maladaptive when maintained afterward, creating exhausting baseline anxiety. Post traumatic stress disorder is directly defined by trauma exposure and includes intense anxiety as a core feature. Panic disorder often emerges following trauma, with panic attacks initially linked to trauma memories that generalizing. Social anxiety frequently develops after experience of humiliation, bullying, or public shaming. When anxiety is rooted in trauma, standard anxiety treatment may be insufficient or even potentially harmful if trauma history is not recognized and addressed appropriately. So, treating anxiety without addressing underlying trauma often leads to incomplete recovery, symptoms persistence, or relapse. Not all anxiety relates to trauma. Comprehensive assessment is essential to understand individual presentation. Summary of my finding. First, anxiety disorder are common but treatable mental health conditions affecting millions of people across their lifetime. Second, they arise from complex interaction between genetics, environment, and trauma. Understanding individual risk profiles enable targeted prevention and early intervention. Third, effective management requires a combination of therapy, medication, and lifestyle support. Combined approaches typically shows best outcomes. Finally, trauma plays a fundamental role in many anxiety disorder presentation. Adverse experiences, particularly in childhood, create neurobiological and psychological changes that maintain chronic anxiety. Trauma informed approaches are essential for effective treatment when trauma is present. Ignoring trauma history leads to poorer outcome and potential harm. Personal reflection. SNOC 206 has profoundly transformed my understanding of anxiety disorder and mental health more broadly. I have developed deep appreciation for anxiety as a complex biopsychosocial phenomenon. Most impactful has been learning about trauma's central role in many anxiety presentation. Understanding how adverse experiences, particularly in childhood, fundamentally alter brain development and create lasting vulnerability, reframe my entire perspective. I now see much anxiety not as an inherent disorder but as an adaptive response to genuinely dangerous circumstances, a response that persists when no longer needed. As a future nurse, I aim to provide evidence based, trauma informed, and person centered care to support individuals living with anxiety. This course has fundamentally shaped not just my knowledge but my values and approach of supporting people experiencing mental health challenges. Thank you.